I'm going to speak. And then anyone who, a designated representative, whoever would like to speak against the executive order, either or both of them, can have an opportunity to do so next. And then I'm going to ask somebody, well then listen, then you'll have to be quiet down so you can listen, because I'm not going to talk any louder.
No PA system? Thank you, Mr. Dayton.
What I said was, I'll speak. Then if there's somebody who'd like to speak against the executive order, you come up and have the microphone to do so. And I ask everybody, you know, this is a democracy. The great thing about democracy is we can have different points of view. And this is an office where all points of view are honored and respected. And then I'll ask, and then in the interest of time, I'm going to ask just one of the people here, let's say two of the people here who are going to speak on behalf of it. And I'll allow one other person to speak who's opposed, and then I'm going to sign the executive orders. And if someone can't abide by that ground rule and insists on being disruptive, I'm going to ask security to escort them out of the chamber for the safety and protection of everybody, because as you see, we have a lot of people gathered here today. So, as my first official act as governor, I'm going to take two important steps. One is to sign an executive order committing Minnesota to the so-called early opt-in for Medicaid that is essential to providing better health care to all Minnesotans. It will provide $1.2 billion in federal funds, which the Minnesota healthcare providers, including the Minnesota Medical Association, the Doctors of Minnesota, the Hospital Association of Minnesota, have requested for months now to enable them to be reimbursed at better rates for providing health care services to low-income Minnesotans, so that they in turn can not divert resources, particularly hospitals, from emergency room care for all Minnesotans. So this is a step that benefits all the people of our state at no, and I repeat, no net cost to the state of Minnesota, according to the Department of Management and Budget, which is the official budget arbiter for the state of Minnesota. And according to figures that they provided me that came from during Governor Pawlenty's final month in office, so under his officials, the net cost to the state general fund of this early opt-in in the next biennium will be $384 million. However, the offsetting savings to the Healthcare Access Fund, which is another part of the state accounts, but very real dollars again, is $416 million, for a net savings in the next biennium of $32 million. Now, all this assumes, and the Department of Management The Department of Management and Budget's assumptions assume that this opt-in will begin very soon. But we learned, much to my surprise, I think the surprise of most others last month from the former commissioner and the previous administration of the Department of Human Services, is that this early opt-in would take up to 9 months. I find that absolutely unacceptable. I find it very... I find it extremely unfortunate that this information was not better disclosed to policymakers, to the public, and to those who were concerned about this matter over the last several months. But that has already occurred. I'm now responsible, and we will have very soon a new commissioner of the Department of Human Services, whose first and foremost mandate will be to do everything humanly possible to accelerate that timetable of conversion, which is a state responsibility, so that this can actually begin as soon as humanly possible. So let me invite up here anyone who would like to speak against the proposal, and you can have the same 4 minutes that I just took to make my statement. Somebody would like to do so? Yes.
Well, first of all, I'd like to thank Governor Dayton for giving me the opportunity to hear the opposition. Does it work?
You just speak in there for the press. So
oh, sorry.
It won't amplify it, just the press will pick it up.
Okay. So first of all, I'd like to thank Governor Dayton for giving the opportunity to hear from the opposition, because this is really phenomenal that you did it, and I just want to thank you for that. I guess what I would like to say for the reasons why we would like Governor Dayton not to sign the executive order is because it really puts the state in peril when it comes to costs. There's something called tails, which means once all of these people are on, it will be difficult to get them off, and it will be expensive to the state for the long haul. And we see this as a very expensive way to cover the needs of people who really have needs. It's not about insuring people, it's about getting them access to care when they need it. And we will empower the HMOs through this transition into giving more money to the state, because it doesn't go to the state. It goes to the state, but then it goes right to the HMOs, who have the power to deny access to more people. The other thing that I would say is that the cost of this, the fact that the taxpayers have to pay for it, means that the hardworking people of this state have to pay more out of their dollars to other people, making it more difficult for them to pay for insurance in the end. And the fact is that the more people that are on state-covered insurance means that the cost will be shifted to private insurance, making private insurance more expensive. And that means it will be harder for all of us who work to actually afford health insurance, and we will be enrolled in Medicaid eventually as well. So for all of those reasons, and because it takes away our freedom, because it expands government-run health care, because it puts bureaucrats in charge of patient care, for those reasons we ask Governor Dayton not to sign the executive order. Thank you.
Now I'm going to ask Mindy Tomford, who's with the Olmsted Medical Center, her admissions office, to present briefly her reasons for supporting this. Then I'll invite someone else who would like to speak in opposition, and then I'll ask one other individual to speak in support, and I'll ask another individual to speak in opposition. So, Mindy, welcome. Thank you.
Thank you. Hi. My name is Mindy Tomford. I live in Mazeppa, and I work at Olmsted Medical Center Hospital as an admissions clerk. I also sit on the executive board of the Healthcare Workers Union, SEIU Healthcare Minnesota. I haven't always worked in healthcare. In fact, my husband and I are farmers. Like so many other farm families, we decided to sell off the dairy part of our farm so we could have health insurance. That's when I joined OMC Hospital. At the time, I had no idea just how common our fight for affordable health care was. Working in patient admissions, I see adults and kids with no insurance every day. Like all of us, they're working harder every day to make ends meet. Either they are making too much to qualify for Medicaid, or their work doesn't offer insurance. Or there's insurance, but they can't afford to pay the premiums. It's scary seeing all those kids using urgent care as their primary health care, or primary care, because they can't afford it to go anywhere else. My experience at work and at home are why I fought to make sure Congress passed the Affordable Care Act to ensure everyone gets coverage. When my oldest daughter graduated from college and took her first job, she spent 2 years without health insurance. She weighed too much to qualify for public assistance, and then she couldn't afford to pay for it herself. And now that my youngest is graduating, she's underneath the new one of the Affordable Care Act. So she can stay underneath my insurance until she's 26. I am so proud that today Governor Dayton is taking action to bring the benefits of the Affordable Care Act to working families in Minnesota by expanding access to Medicaid. It will provide thousands of Minnesota with quality health care. And let me be clear about one of the most important and direct consequences of Governor Dayton's action today to expand access to health care. The up to $1.4 million in new federal funding will create or save more than 20,000 good jobs. Family supporting jobs for workers in our hospitals and clinics all across the state. In these difficult economic times, nothing is more important than making sure Minnesotans have a good job they can depend on. Thank you.
Thank you very much. Thank you very much. Thank you. Well said. That's mine. Now I'll invite someone who'd like to speak in opposition. Yes, sir. Yeah, saw your hand next, sir. The hat. You're welcome. How are you this morning, sir? Thank you for coming.
How are you?
Thank you for coming. Good, thank you.
Good morning. My name is Leon Moll. I volunteer as a state coordinator for the Minnesota 10th Amendment Center. I am a combat veteran. I proudly took an oath to serve and support the Constitution of this country. I do not find it painful to expect any elected representative to do the same. If you can show me anywhere in the Constitution where it says that Congress has the authority to legislate health care, let me know. I have gotten my medical care courtesy of the VA for the past 41 years. I totally understand what government health care is all about. I oppose this legislation.
I'm asked people to applaud those they want to support, agree with, and to be respectful with their silence of those that they disagree with. So I have one more on each side. I'll apologize to those who came. I'll give you a pen instead. But let's, for the purposes of time, allow one more proponent and one more opponent. And Sarah Anderson is speaking here on behalf of her brother. Welcome, Sarah.
Thank you. Hello. First, I'd like to say that I'm honored to be in the presence of Minnesota's strongest advocates for health care, as well as yourself, Governor Dayton. My name is Sarah Anderson, and I am the sister of Eric, who is a brave, kind-hearted gentleman who was denied access to health care when he was on GAMC. In May of 2010, my brother was diagnosed with a very rare and aggressive form of cancer. The company that he had worked for prior had gone out of business, and so therefore leaving him unemployed. And after the unexpected diagnosis of cancer, he was in need of state assistance for health care coverage. While Eric was grasping with the new reality and struggling to recover from his diagnosis and cancer, he needed help navigating through the system of bureaucracy of our public health care system.
Just wait 1 second. We have to go it down. Thank you. Go ahead.
When the world feels alone, it's your family that walks in and stands by your side. And as a clinical social worker and a sister, I was proud to be able to help him. However, we quickly learned that because of the cuts to GAMC, my brother was denied health care needed to treat his life-threatening cancer. It is because Governor Dayton's commitment to sign the executive order opting Minnesota into Medicaid that there will not be another sister who is forced to watch her brother desperately wait days, then weeks, and months for necessary information and treatment. There won't be another gentleman scared to fall asleep at night because he doesn't understand or know the extent of his illness. Because of the Medicaid expansion in Minnesota, there will not be another family who helplessly has to watch as their sick one is denied care. Support can now be given to them because a doctor appointment is necessary, not necessary, and unavailable. There will not be another brother asked to sacrifice his personal privacy as well as his dignity, while his family tirelessly pleads for and advocates for the worth of one life, as well as the continued blessing to have him in it. It is not possible for any law to prevent the panic and the unfortunate sadness associated with any serious or chronic medical illness. We are all vulnerable to it. However, the healthcare in Minnesota is far more safe and secure because of Governor Dayton's actions today, leaving this citizen, this social worker, and this sister very humbly grateful.
Is there someone else who'd like to speak in opposition? Then I would. All right. Let him, give him some space. Get up here, please. I don't know which ones, whichever you I. Welcome.
Thank you, Mr. Dayton.
Thank you.
Well, after hearing the last story, I too have a grandfather that just passed away from cancer. He was a Korean War vet. And I'm thinking to myself, where is the church to help these people? Because that's the church's job and duty, is social causes. I don't find in the Constitution where the government's job is to do that. It's for nonprofit organizations. It's for the church to do what it rightfully should do. I don't blame somebody for feeling that when the church doesn't do its job, we've got to do something. I agree, we need to do something. There's no doubt about it. But when we step outside of our bounds where constitutional authority lies, and we start to take that authority on ourselves, because we can create an executive order, it has a ripple effect of destroying societies. What we need is not a strong centralized government. What we need is strong centralized self-government of the people that will look out for each other, just like this poor woman who died. The church should have been looking after her. I've got news. I've got news for you Minnesotans. The answer is not found in bigger government. God bless the government for doing what it should do, and what it will do, and what it's supposed to do within the confines of the Constitution. The rest of the power and authority is vested in you, the people, to make this place better. Not in bureaucrats and not in elected officials. Their job, they're desperately, Mr. Dayton is looking to you Minnesotans to make Minnesota better. That's not his job. That's your job. It's our responsibility and it's our duty, and I say God bless Minnesota because he has. God bless America, and God bless your efforts for making it a better place. I feel that this amendment and this usurpation of authority here, because that's what it is uncalled for and it's unnecessary. It lies within each one of you. And if somebody can show me where I'm wrong constitutionally, that this executive order is outside of that scope, outside of the authority in the Constitution, I would like one person to do that, but you're probably not going to find somebody doing that today. Because again, we dwell in emotion. Let's not trust a government system. Let's trust the Spirit of God in each one of your hearts. That's what I say.
Again, I apologize. I want to recognize and thank especially legislative leaders in the last legislative session who passed the authority by which I signed this executive act today, and who also was signed then by Governor Pawlenty for his doing so, which in a bipartisan concurrence provided me as the new governor with this opportunity, legally sanctioned. And I also want to say that I will be signing a second executive order at the same time, which rescinds Governor Pawlenty's previous executive order, and which has the effect of permitting the Minnesota Departments of Commerce and Health to apply for federal planning grants for the purposes of setting up the healthcare exchanges. And other federal health care planning money. And I have spoken with Secretary of Health and Human Services, Sebelius, and who's also been contacted by Senator Klobuchar and by Senator Franken to ask for her forbearance in a maximum latitude in these departments applying for these important healthcare planning funds. So I'll proceed to sign those executive orders, and then I'll respond to any questions that the press has. And I want to recognize also Lieutenant Governor Pretner Solon for her leadership in that endeavor. And again, specifically thank former Speaker Margaret Anderson Keller, who's here, for her leadership, former Majority Leader Larry Poggemiller for his leadership, still Representative and former leaders Aaron Murphy and Tom Huntley, and Senator Linda Berglund for their leadership in making this possible. Thank you.